Anyway, we're going to talk a little bit about stem cells and some anti-aging. All right, so basically, you see a little picture up there. You know, I have a nice tan. I live in Florida, so obviously we have a lot of sun, not quite as much as here. But I like to work in my garden, and stem cells is like working in a garden. What do you have in a garden? You have soil, you have seeds, and you have fertilizer. Well, in this case, our soil many times is the fat. Fat is a great scaffold. Our seeds come from both bone marrow and from fat, very rich sources of cells. Notice I said cells. It's not just stem cells. There's a whole host of cells. And I want everybody to think about it. I want you guys to think and tell me what the most important stem cell is. But just think about it. You don't have to tell me yet. We'll come to that in a little bit. And last but not least, in a garden, you have fertilizer, the growth factors. So all these things together come and do things. All right, let's go to the next slide, please. All right, so this is some of the places I work. Mainly I'm working in Boca Raton, but I do work in Pensum. I've been here, what, 4 years now?
Yeah.
And I do work in the Dominican Republic also. There's certain things I can't do in the United States that I'll do in other places. Now here in the Caymans, we can do things either allowed by the FDA or the European Union. This is not a free-for-all here that we can do whatever we want, believe me. It's very regulated here also. Okay. Now, has anybody here had your physician get you better? I don't get people better, in all honesty. Cells, not doctors, heal the patient. No matter what you have done, if you have a hip replacement, you have open heart surgery, ultimately your stem cells and other cells have to heal you. They have to heal the wound. They have to incorporate that piece into the body. So cells, not doctors, heal the patient. This is the major tenet of regenerative medicine. And I've been involved in regenerative medicine for about 15 years now. I was the founding member and president of the American Academy and Board of Regenerative Medicine. I'm going to be the next president of the American Association of Stem Cell Physicians. So I've been involved in this for a while. So let's go to the next step. All right, next slide. Platelet-rich plasma. This is the fertilizer. So if I were to get a drop of your blood and I put it under a microscope, you see these little structures right here. These are platelets. Now, that's fine, but if I get, now platelets can sometimes be our friend, but sometimes it can be our enemy. What happens? Sometimes, unfortunately, your platelets get together in your vessels, like an artery or something, and they see there's a little injury to that artery. Says, oh, well, we're attracted to an injury. They try and fix that artery, and next thing you know, you have a blood clot there, and you either get a stroke or a heart attack. So, not always a good thing. But if I get these platelets and I spin around in a centrifuge and I concentrate them, let's have the next slide. Voila, we now have platelet-rich plasma. So I've got my fertilizer now. So I've got that. Let's go to the next slide. Okay. So now, how do these platelets work? You get a cut. I like to always go to practical things. We get a cut, we put pressure on it. Keep putting pressure, keep putting pressure. Ah, thank God, it finally clotted. Well, that's all well and good, and platelets do have a clot. But if you notice here, there's a lot of different insignias here. We have like VEGF. What does that mean in English? Vascular endothelial growth factor. Boy, that's a big word. But what it means is it's going to be some growth factors that are going to try and establish a blood supply where there may not be one, okay? We have another one here, it's a very common one too, called IGF-1. You may know that by a different name, called human growth hormone, okay? Human growth hormone, okay, HGH. Now, all these things work in unison with each other, and they work basically like something I have in my pocket. May I have the next slide, please? The body's cell phone system. Those signals are how cells communicate with each other. They tell cells what to do. They turn on certain genes in the body and things like that. So I call it the body's cell phone system. These are called cytokines. No matter what condition you have, ultimately the cytokines are going to either make you get healthy or make you get sick or maybe make you die. It's as simple as that. We'll get into that in a little while. Let's have the next slide, please. All right, so basically we look at the cell membrane of a stem cell. Now the cell membrane is the eyes and ears of the cell. It interacts with its environment. So one thing right off the bat that I always tell my patients is, you know what? We need to get that membrane in as good a shape as we can to maybe respond things. So what do? I say, you know what? Omega-3 fish oil. Why? Because our diets are rich in a lot of what we call omega-6s, which are the bad fats, okay? Now, omega-9s are the good fats. That's olive oil, that's avocado, walnuts, things like that. So That's something. So that right off the bat, we want to do it. Now here we can see on the left side here, we see the platelets that are activated. And they'll go on to these growth factor receptacles, and then they start telling the cells what to do, okay? Now many times the cells will act as little biochemical factories and make things, but let's have the next slide, okay? So basically what the growth factors do, just like fertilizer in the plant, it makes the plant start growing, it makes it start doing all sorts of things. Next slide, please. So if I were to get some of your blood and I break it down with a centrifuge again, I get a couple of different things. I have something called the erythrocytes. Those are the red blood cells. They carry oxygen, obviously they're important. Then we have the watery part of your blood called the plasma. And then we have something called the Buffy coat. Okay, now the Buffy coat is very interesting. It has some stem cells, it has the platelets, and it has something called leukocytes. Okay, leuko is a Greek word for white, the white blood cells. White blood cells and stem cells and everything, they're like this. Your immune system, I'm giving a talk in 2 weeks in Orlando, or 3 weeks, about the immune system and stem cells, because they're so important. But what we're interested in this case is this little guy right here, this Buffy coat. And that really has all the real rich things, but they all have importance to them, okay? Next slide, okay? So we use, this is just one type of centrifuge that we use many different types. Next slide, please. Now, talk about stem cells. Anybody have an idea what the most important stem cell in the body is?
Bone.
What?
Bone.
The bone? I don't think the cardiologists are gonna like that.
Okay.
All right, let me give it a different way. What do you think the most important instrument is in a symphony orchestra? I want everybody to think about it a little bit. Remember now, it's a symphony orchestra, stem cells, a lot of little kind of nuances that are together. All right, so conductor is not an instrument. Okay, everybody wants to say that. Okay? So when we talk about adult stem cells, most of the cells that we're talking about are what we call multipotent, meaning it can go to many different tissue lines, but it can't form everything. Now there are some cells that are pluripotent, and they can go into almost any type of cell. So those are if we could make those or get those are the best of all. And we do have ways of getting them. They're found in each and every one of us, but they're kind of like a little treasure in us, and we have to kind of get ways to coax them out and everything. May I have the next slide, please? So this is something called a stem cell niche. You know how you have a niche in life? Well, the stem cell has its own little niche too. And we can see it's dependent on so many different factors. It's dependent on cells that are around it. It's dependent on our immune system. It's dependent on other portions of its environment. The environment is very important. And that's what, when I talk to the doctors, I tell them, a lot of the studies that you see about stem cells, unfortunately, really don't have much practical sense, because when you take a cell out of its environment, you're changing things so dramatically that that cell may not do what we think it does. So that's one of the problems that we have. So I don't know if you saw that, but let me ask you this question. If all your stem cells stopped working, how long would you live? Take a couple guesses. Nobody gets penalized.
A day.
A day? Did you see that slide? Interesting enough, a day or two. Let's go to the next slide. Now, let me tell you the practicalities about this, okay? There are certain conditions that we say, you know what, we can, you have a certain kind of cancer, for instance, or even multiple sclerosis sometimes. They say, we may be able to save your life, but what we have to do is we have to poison your entire immune system, kill all your stem cells. The problem is some of those people unfortunately don't survive because of the fact that when you don't have stem cells, you can't fight infections. And many times you can bleed to death because you have no compounds that will, clot your blood and everything. So 1 or 2 days without stem cells. So if you think they're not too important. So the type of stem cells that exist: embryonic, adult mesenchymal, hematopoietic. Anytime you hear the word hemato, like a hematologist, it means it's blood, like a blood specialist. An iPS cell, induced pluripotential stem cell, okay? Other more specific type of cells. And then one of my favorites is something called a very small embryonic-like stem cell. Now let's go to the first one here. Let's go to the next slide, please. Now, embryonic stem cells, this is what gives a lot of us a black eye. Now, this is not to be confused with amniotic, okay? They're totally different things, okay? Embryonic stem cells come from an embryo, okay? Unfortunately, it has to just be aborted or something to get it. So you go back in the history of this, the first president who said, in the United States, this is now, that said, hey, stem cells are going to revolutionize medicine was Ronald Reagan. He said, not in my lifetime, not probably my kids or my grandkids, it's going to start revolutionizing things. He's right. And then you start going along further, and then we come to the second George Bush. And he got elected, and he says, all right, tell me about these stem cells. Because everybody says, oh, George Bush stopped all stem cell research. Not the case. The scientists went to him and says, you know, these embryonic cells, we're kind of at a dead end with these guys. These guys, they have a lot of potential, but boy, you put them in the body, they form tumors, and they do all kinds of bad things, and they may attack the body because they're basically like a wild thing. So he said, well, let's kind of curtail the research on the embryonic stem cells, not umbilical and things like that, but we allow other stem cell research. So he did that. But now let's put the ethical issues aside. I'm going to talk to you as a scientist. Why aren't these cells good for us? Okay, next slide, please. These are, again, cells from embryos. Okay, you could potentially get any kind of disease that embryo has. That embryo may be programmed to have a disease like Parkinson's at 60 years old or something, okay? These cells can go and form a type of tumor. It's a tumor that has all kinds of crazy body parts in it, okay? And most importantly, these cells can do something called a graft versus host disease. They're very powerful cells. They can attack the body, and the body will try and attack them. And you literally have a war on your hands, and it can be a life-threatening problem. Now, I've got a good friend of mine who is in Australia. He's gotten this cell line and he's propagated and he's kind of manipulated it a bit, and he's been able to encapsulate them. And he's made this particular cell line produce large amounts of human growth hormone. Guess who's very interested in this cell? The US Department of Defense. Because what they'd like to do is inject their soldiers with that, because you can't use human growth hormone in an athlete. If I were to do that, boy, I'm going to get crucified because I'm giving them performance-enhancing drugs. But you don't care so much about a soldier. And because these things are encapsulated, they live in symbiosis with the body. The body gives them nutrients, they give the body HGH, human growth hormone. So an interesting thing. So, next slide. That was a picture of Dolly the sheep. Everybody remember Dolly?
Yes.
Right, Dolly was cloned, but what did Dolly die from? Anybody know?
Old age.
Who said that?
Maybe me.
Very good.
My last answer.
Why was it? You're the head of the class now. Were you kidding me? I'm going to have you lecture. Go. Seriously, but why did she die of old age? Why?
Sheep's cloned from old sheep.
Exactly. Her DNA was old. That's exactly right. And that, most docs don't even get that. So I'm very proud of you. That's good. So let's go to that slide, Peter. But what I have to say is an iPS cell and a clone are not the same. Okay? An iPS cell is when I were to get one of your skin cells and I treat it with either an enzyme or a virus, and I kind of manipulate its DNA a bit, and I make it behave very much like a embryonic stem cell, but it's your own cell, so we don't have the baggage of that. It's not going to attack the body. It's going to do a lot of interesting things. And is it important? You betcha. Nobel Prize 2012. The problem that we start having with these cells, though, is that we've found, especially when we used a virus, it turned on something called an oncogene. Now, you heard of the word oncologist. It's turning on cancer genes. So we're trying to abandon using the virus vector and maybe just using an enzyme. Let's have the next slide, please. So here is what we call the DNA. Now, the ends of the DNA are what we call the telomeres, okay? Which is a very important concept in aging, okay? And the longer your telomere, the more efficient the cell is. This is one of the reasons why if you have a child or a grandchild, you say, get this blood and put it in the bank, because the telomeres were the best they were ever going to be when that child was born. Your telomeres, unfortunately, were better this morning than they are now, and they're going to be worse tomorrow. It's a relentless process. It keeps on going and going. Let's take another slide, please. Okay, so telomere science is important, you betcha. Nobel Prize 2009. And that's one of the problems that we run into with some stem cells, because the shorter the telomeres, the maybe not as effective they are, but they still have some good effects. So let's go to the next slide. Okay, so this is a very interesting slide, and this is going to tie into my talk in a little bit. Unified theory of aging. This actually comes from an article about a good friend of mine, Dr. Bill Andrews, who is a specialist on something called telomerase. But this is from the work of Dr. DiPinero at Harvard, and what he said is, you know what, as these telomeres get to a certain critical length, it's programming the cell to die. And then some of those cells, unfortunately, don't die and they go on and they can cause havoc in the body, but we'll talk about that in a little while. When our cells divide, our telomeres shorten. Telomeres shorten means a decline of health. And actually, let me see the next slide. Look at all the diseases that are associated with short telomeres. Heart disease, lung disease, cancer, arthritis, osteoporosis. Okay, that's an autoimmune disease also. Osteoarthritis, rheumatoid arthritis. Anybody know about progeria?
Yes.
What you know? We got the
children-
class.
There are children born who age extremely quickly.
Right. There's a child, he's an 8-year-old, he looks like an unhealthy 80-year-old, not even a healthy, unhealthy 80-year-old. And what did they find? That their telomeres are like that of an 80-year-old person. So, like that of an 80-year-old person, an unhealthy 80-year-old person. I'm not even gonna say healthy. It's a tragic disease. Let's go on, next slide. Okay, so we see this gentleman here. We're gonna take a look at his skin. Okay, so those are his skin cells. Next slide, please. We're gonna now take a look at it with the electron microscope. Next slide. Okay, so now we go and look at his nucleus. And those are some of his DNA strands. Next slide, please. And we're looking at him more, and all of a sudden we're gonna see the telomeres pop up. Next slide. Next, yellow. Okay, so, very good. Next slide, please, people. So now let's see what happens when the baby is born. Next slide. So there we have a newborn, or an embryo, I should say. Next slide. Look at the size of that telomere. Next slide. Now all of a sudden, that embryo is going to start getting developed, and that's going to be born. And look what happens to the length of the telomeres. Next slide. As that telomere gets shorter. So we know telomeres are one of the important things in life, okay? Now, there is an enzyme called telomerase. Now, telomerase is an enzyme that actually restores the DNA, okay? Now, we know a couple of things. There are some cells in our body that actually make telomerase, and one of which is the reproductive cells. That's why a man, unlike Dolly the sheep, a man could be 80 years old, he can foster a child, and that child's gonna be having DNA that's as long as it should be. Now, he may have some DNA damage from being 80 years old, but that DNA is still gonna be long because the telomerase preserved its length. Now, the problem we have, you say, okay, great, let's just get telomerase and just take it. There's another cell that makes telomerase, and that's a cancer cell. That's why cancer cells are immortal. They never die because the DNA just doesn't age. So there's good and bad with telomerase, and it's a kind of a balancing circle. And there's a lot of research on it, but some of the interesting research for cancer drugs is they attack telomerase. So we'll see. So here's some of the things, and this is a good slide, and anybody that wants this can get this slide from, or any of the slides from Miss Marla, but it shows you some of the things that affect the telomeres. Vitamin E, and it's only a certain form of vitamin E, for instance, vitamin D. Vitamin D is one of the most important vitamins you can. Vitamin D is not a vitamin, it's basically like a hormone. But all these things can have some effect on the telomeres, so it's a very important thing. Okay, so now one of my favorite guys is the very small embryonic-like stem cell. There's a couple of different names for these cells. Now, they're in our body, and I consider them what they call an emergency stem cell supply. They get activated only under a dire stress. God forbid you're in an accident, you lose half your blood supply. They get to work and fix any organ damage you may have or something like that. They're found typically in the blood, but they usually are what we call quiescent. They're asleep. Now, the interesting thing about these, unlike almost all the cells that we deal with, these cells are pluripotent, meaning they can turn into anything. You can turn into brain tissue, lung, heart, cartilage, bone, etc. Most cells, remember now, almost every cell we deal with is multipotent, meaning it can only have certain cell lines it can go to. Next slide, please. And what else do these cells make? Well, guess what? They make telomerase. So that tells me that each and every one of us has some cells in our body that are really nice and kind of pristine and juvenile and full of life because their DNA hasn't really aged, okay? Very much like an embryonic stem cell, okay? So that's an important thing. But the interesting thing about these, even though this is a cutting edge form of stem cells, it's one of the oldest forms of stem cell therapy known to man. May I have the next slide? Because it seems to be the basis of acupuncture. I'm not an acupuncturist. I'm an orthopedic surgeon, regenerative medicine, but let's have the next slide. What we found is there's certain channels in the body that the acupuncturist knows about. They're called Bonhan channels. And we find that these cells are very, very concentrated in these channels. So most likely the beneficial effects of the acupuncture are because they're activating these cells in some way, shape, or form. So what do we observe with these cells? Well, let's see. Next slide. Okay, interesting thing, okay? When I give these cells intravenously, now how do I do these cells? Basically, it's a 2 or 3 day process. On day 1, you come in and we'll give you intravenous CoQ10. Good luck finding that somewhere. You can scour the internet, and I can guarantee you won't find it, okay? It's our personal thing. Or we give it to you by a patch, which may even be more efficient. But what does that do? That stimulates the bone marrow to secrete large numbers of these cells into the circulation, but they're still asleep. So day 2, you come in, we draw a large amount of your blood. We then have to shock these cells at 4 degrees centigrade. That's the real magic number. 4 degrees centigrade awakens these cells. And then we have you come back in the next day, and then we give them to you intravenously. Sometimes I'll put them in the joint, but these are more for systemic things, for anti-aging, for autoimmune diseases. But look at this here. This is a scientific study, very reputable journal, Stem Cell Research and Therapy, okay? What did they find here? They said, hey, you know, these cells increase the telomeres of the cells of the immune system. That's profound. This is one of the most important slides of this whole talk. Why? You're as healthy as your immune system. If we make your immune system healthier, and if we make the telomeres longer, meaning the cells are more healthy, your immune system is on patrol every moment of the day, 24/7, looking for cancers and things like that. It's when it fails you, these cancers grow and things like that. So this is pretty profound. These are cells of the immune system that we're actually making healthier, better. Okay, so the other thing we have to do is we have to use a little bit of parathyroid hormone, and we have a patch. It's a very painful injection, and I think, Marley, you got one once, didn't you? Yeah, it wasn't nice, was it? Years ago, but now we have a nice patch that we have, and it's a very nice, easy way to do it. And we know the dosage and this and that and everything. Okay, next slide. And what that also does is that also helps regenerate cartilage, and it also helps make more stem cells leave the bone marrow and go into the circulation. So it's kind of like a good vicious cycle. All right, next slide, please. And the other thing that we found, I just had one of my patients today from the Caymans came in and he said, hey, they were going to put me on all these bad medications for my bones, but you know what? The doctor said, wait a minute, you don't really need this. Your bones are better. We've been doing these V cells on them. We found that these V cells help with osteoporosis. Let's have the next slide. Talk a little bit about osteoporosis. It basically means your bones are getting weaker. They're losing their strength, their integrity, so to speak. Next slide. Look at some of these statistics. If you get a broken hip, you have a 20% chance of dying in the first year. That's pretty, 1 out of 5 people are not going to make it for the year. Okay? And if you're a woman, a 50-year-old woman has a similar lifetime risk of dying from osteoporosis as she does from breast cancer. So this is a serious problem. And guys, we get the same thing. We may be down the road a little bit, but the same thing can happen to us. Next slide, please. So these are some of the medicines. In all my years of orthopedics, I've never given these medicines because typically they can kind of maybe slow the process down, but they don't arrest it. With one exception, something called Forteo. This is a medicine where you have to give yourself an injection every day for 2 years. Then you have to stop, however, because the FDA said, we don't think it's a good idea to continue on this after 2 years because the animal studies show that the animals were developing something called an osteosarcoma, which is a bone tumor that typically requires an amputation of the extremities. So be my guest if you want to go on those. A lot of bad things. Okay, next slide. And we've been doing some studies on them. We're actually going to publish some studies one of these days. We had one lady, she had severe osteoporosis of the hip and the spine. Didn't respond to all sorts of treatments. We gave her some V cells ×2. Next slide. And she had this is the second case, okay. Well, this is another patient here. Again, bad osteoporosis. Let's take a look. Okay, this lady had 30%, essentially a 30% improvement in the T-scores. Unbelievable. I mean, if you can get an improvement of about 3-4%, you say, hey, we're doing our good. I mean, if you can just stop it dead in its tracks, you're making progress because it's a relentless disease that keeps on going and going. So some pretty interesting things, in addition to hopefully making your immune system better. You know, we think osteoporosis is an autoimmune disease. Autoimmune means the body's attacking itself. And we're pretty sure that that's an autoimmune disease. Believe it or not, one of the best supplements to take for osteoporosis, melatonin. What's the most important stem cell? We'll put that aside. The most important instrument in that symphony orchestra, what do you think? The which? The heart? No, well, the heart's an important one, but I'm not telling you. Let's do something easier. Let's go about the symphony orchestra. What's the most important instrument? The violin. What are the trumpet guys going to say? They're not going to be too happy.
Drama.
The bottom line is they're all important. This is why it's a symphony. They work together. It's a trick question. I love trick questions. Wait until you see the trick questions I'm giving these guys next week. Oh boy. Lisa saw some of them, my assistant here. All right, same thing with stem cells. There's not one that's the most important stem cell. They're all important, okay? But mesenchymal stem cells, this is a very interesting thing. This was the one that was first named by Dr. Arnie Kaplan from Case Western. He's kind of the grandfather of stem cells. And he said, you know, I thought these were like the big kings and everything, but you know, I think I'm wrong. They may not even be a stem cell. He said, well, he said, really? He said, yeah. He says, now these are the cells that you find, you know, in fat. You find them in, if you deal with, you know, when you save your child's cord blood, you find them in those and things like that. Let's go to the next slide, okay? So what do these cells really do? They do something called immune modulation. Boy, that's a big fancy word. Let's think about it in a practical sense. Remember that cut I had? I put pressure on it. I kept putting pressure. Ah, good, it clotted. And what happens all of a sudden, 2 or 3 days later, oh my God, I must be getting an infection. It's all mean, red, and angry and starting to hurt me. No, it wasn't infected, it was inflamed. The body deals with inflammation. Now, if the inflammation does not subside, the body will never heal the thing. So what these guys do is they go in and they start releasing certain growth factors, cytokines, as you like to call them, that will kind of calm down the inflammation to let other cells do their work. Without that, healing cannot occur, okay? Next slide, please. Okay, so like I say, what Dr. Kaplan now says, hey, these cells are not really mesenchymal stem cells. These cells should be called medicinal signaling cells. Remember, like I said, my cell phone, here it is. It tells the cells what to do. It says to this cell, you know, you make a reproduction of yourself. Like the cells that I inject in a patient from the bone marrow, the fat and everything, they're not gonna turn into articular cartilage or a rotator cuff. They're gonna basically make other cells do that. They're gonna recruit the cells to do it. That's a misconception that a lot of doctors have that, oh, the cells we're putting in there are turning, no, most of them don't engraft, most of them die, but they release the growth factors and things like that. So, next slide. Now, this is my great slide. I love this slide because it says what mesenchymal cells are like. They're like Navy SEALs, okay? They get put into a hostile area. They're probably not going to survive, but most likely they're going to get the area secured. Can you see any Navy SEALs in there?
No.
All the time I've been looking at, I can see one right here with 2 arms and his leg, okay? And I see a guy waving his hand right here, and that's it. I haven't been in the military. Peter, you're a Navy guy. What do you think?
Oh, well, probably about 7 in there, yeah.
About 7. Well, what are the British? What's the British Navy called? SEALs. They have.
Oh, they have the SBS, Special Boat Squadron.
Okay, very good. All right, so next slide, please. All right, so here we have some of the things that these mesenchymal stem cells do. They can prevent scar tissue. Angiogenesis means it grows blood vessels where there isn't any. Immune modulation. It can help other cells grow. It can protect our brains. It can make more blood cells and things like that. But there's one interesting thing that it does here. LL37, okay? LL37 is what's important for the survival of the human race, believe it or not. Let's go to the next slide. What does LL37 do? It's a very potent antibiotic antiviral. It kills basically anything that's, you know, invading us. What's the practical aspect of this? Think of a woman during her menstrual period. You have an open body orifice, there's all sorts of bacteria around there, blood, you should get a sepsis and die, and yet most women never have a problem. Because the LL37 in the menstrual blood just kills any bacteria that could crop up. So, and they're looking at this as possibly an antibiotic to, you know, do away with all antibiotics, a natural antibiotic. So a very interesting thing. Next slide, please. Are there any risks with these cells? Nope. As long as you use your own and you don't start manipulating them, then you're going to be okay. Now, hematopoietic. These are the, let's put this, the mesenchymal are like the Navy SEALs, the hematopoietic are like the Army. There's lots and lots of them, and they're going to go in there and they're going to actually clean up the area and get the job done. And those are the ones that really do it. I call those the real workers. Next slide. So basically they do this by the principle of plasticity, meaning they can kind of morph from one type of cell to another. And again, they give orders to a lot of cells. They say, you do this, you do that, you do this. So next slide, please. Now, your fat, believe it or not, adipose tissue fat, same thing. It's a treasure trove of stem cells, believe it or not, okay? Now, let's go to the next slide. Look at all the things that we've gotten from adipose-derived stem cells. Basically what I did today, I got the patient's fat, broke it down with an enzyme, we gave it back to him. In this case, we were trying to attack the basically, the neurons, because he has some MS things. But you know, we do a lot of work with pancreas, diabetes, there's a lot of work being done with that. Heart, orthopedics for cartilage and things like that. These are all things that we get from the cells found in fat, believe it or not, but they're mainly the mesenchymal cells, an extremely rich source of mesenchymal stem cells in your body. Next slide, please. Now, this is kind of a deceptive thing see, I'm kind of like the Switzerland in the world of regenerative medicine. I'm neither a person who just believes in fat nor just believes in bone marrow, because I know that, you know, knowing the science, I know I have to use both. But they'll point this out and say, well, look at all the stem cells in fat compared to bone marrow. Yeah, but you're just looking at this Navy SEALs. Next slide, please. When we look at it all, bone marrow is still the best. It's still the king of the amount of stem cells. Okay, so next slide, please. All right, so what we do is a mini liposuction. Take it usually from the love hand area, we'll give you some local. Takes us about 10, 15 minutes to do, and next slide. And that's what we do. Now, SVF, stromal vascular fracture. Not allowed in the United States. The FDA is really strict about this. They have 2 cases pending. The Department of Justice is trying to close these clinics down, saying this is absolutely illegal. FDA's position is when you break fat down with an enzyme, you've created a new drug. You have to either have an investigation or new drug application or a biologics license. They don't have it. So I'm not the FDA. I'm smart enough to know I stopped doing, how long ago we stopped doing SVF there? About 6 years ago now in the States? This is Lisa, by the way, one of my top 8. I call Lisa, as a matter of fact, she's my Picasso of fat. The way she does fat so well for me when she prepares it. But anyway, I said, no, I'm not going to take a chance with the FDA. So I'll do it here in the Caymans because I know it's allowed and it's all legal and everything. And it works very well. It's a very good thing. Now, if I could do it in the United States, would I do it on every case? No, it's only certain cases I do it on. It's indications, so to speak. Next slide, please. Now you say to yourself, well, if fat is good, it's a good source of stem cells. Well, the more obese I am, I guess the healthier I'm going to be. There's one little problem. When you are obese, the profile of your fat changes dramatically. You have a lot of the bad stem cells, the stem cells, so to speak, that are creating havoc in your body by secreting bad growth factors, which are going to basically lead to diabetes, cancer, and all sorts of bad, degenerative conditions. So that's the problem. And the other thing I have to tell you, you never gain or lose cells if you lose weight or gain weight. The cells get bigger, but they don't increase or decrease in number. But if you do a liposuction, you lose those cells forever. Just keep that in mind. Next slide, please. Bone marrow, okay, good source of cells. Next slide, please. We use local anesthesia only because I like local because it's safe. You start using sedation, there's always a chance you could lose control of an airway. God forbid, look at Joan Rivers and things like that. So we just do it under local, and it's usually pretty straightforward, pretty easy. Takes us less than 10 minutes to do. The problem we have with bone marrow, the number of mesenchymal, Navy SEALs diminishes as we age. So that's the real knock on bone marrow. But if you use bone marrow and fat together, then I can get somebody who's 80, but if I use fat and bone marrow together, I'm going to give them a profile more like somebody 35 because I'm going to get the proper number of cells. So bone marrow and fat, you got to use both. I use fat in the United States. I just don't break it down with an enzyme. I just have to kind of clean it up and put it in a joint, and it works pretty darn well for me. Okay, next slide. All right, now, future target tissues. We have placenta tissue, we have cord blood, we have bone marrow, fat, and PRP. There's a lot of controversy in the US about these things, but the controversy is starting to clear up somewhat. Okay, let's go to the next slide, please. All right, so, most of these products that are on the market really don't seem to have much in the way of live cells. Now, that doesn't mean that they don't work, okay? Because remember what I told you, most of the cells I'll put in will die anyway. But they release growth factors. So we think the growth factors may have some benefit. Let's go to the next slide. The FDA seems to be on the warpath with these cells. The reason is the FDA is saying, wait a minute, you're saying you have live cells in these things? Well, then you've created a drug and you have to get the proper biologics license. So that's a problem because, and next slide. There was a big company in December received a scathing letter from the FDA. It's a company called Livion. And they had about 15, 16 patients become very, very deathly ill from an infection from these products. FDA says, oh, wait a minute, you've got a problem here with your processing. And also, by the way, you need either a biologics license or IND, investigation in new drug application. And then there was a bunch of tests that were done and they said there's really no live cells in these products. So next slide, we'll kind of buzz through this and get to some other things. Just last month, another company, they said, you know what? You can only use these things in the first or second degree relative, and it has to be homologous use. In other words, it has to be used the same way in the donor as the recipient. Next slide. And this is just an ad from the, an article from the Washington Post. Dr. Lisa Forney is a very prominent stem cell scientist, and she said, look, I'm checking these products, I can't find too many cells, but they still have growth factors. And that can certainly give a lot of the good benefits of these things. But, you can also get those in other ways also. So, the jury is out on these things. The FDA is kind of like, really trying to rein them in. So next slide, please. All right, exosomes. Okay, so an exosome is basically what I call is the body's FedEx system. These are like little messenger bits that the stem cells release, and they go from one cell to another. Let's see the next slide if I have it on there. Good, I do. So normally we used to think, this is how the stem cells work. They released all these little growth factors. No, they really package it. So it's like FedEx. It gets to the right place at the right time. Now, one of the largest concentrations of exosomes is in your saliva. Let's say you have a friend. The friend says, oh my God, I got a lot of chest pain. He takes out a little nitroglycerin tablet, puts it under his tongue because then it's picked up by the exosomes, goes to his heart, says, okay, let's go play golf. Chest pain's gone, okay? So that's why you sometimes have to put a medicine on your tongue. All right, so the bottom line is, again, there's no good research on how to use these things effectively though. We know that they probably work well, but you've got to realize one other thing though, some cancer cells also produce these things. So again, jury is out on those. FDA says you can't use them anyway. Next slide, please. Photomodulation. Well, you get something called photoceuticals. I give you a prescription, that's a pharmaceutical. You go get it at the pharmacy. You say, I'm gonna go get some vitamins. You go to the nutraceutical shop. And then photoceuticals are basically how light affects cells and makes cells do things. Next slide, please. So what we do is we have everything that we inject into a patient goes into these lights first. We have a few lights in the lab. And this is an LED light, different colors, and it really can make a tremendous difference because it can really help guide the cells to do certain kind of avenues to follow. All right, now, what do we do a stem cell? When do we do a PRP? Well, typically, the more serious problem, like a bone-on-bone arthritis, we have to use stem cells from the get-go. If you have a little injury to a tendon or something like that, we can probably get by with maybe a little fat and a little PRP or something like that. Now, who's not a candidate? Well, if you've had a bone marrow type of tumor, like a lymphoma or leukemia or something, we don't want to use your bone marrow. Anemia and an infection, no, not a good idea. Now, next slide. Now, what should you avoid? Well, there's this misconception out there, you can't take anti-inflammatories. Hogwash, doesn't mean anything. You can take them the same day. Alcohol, however, does have an effect on the bone marrow. It can diminish the amount of stem cells leaving the bone marrow. So I tell my patients, look, you're going to spend a lot of money on this procedure. Don't drink, because it's going to be bad for you. Now, blood thinners aren't a problem. I never take a patient off a blood thinner. Okay, so what other things are used in the stem cell? Anybody know about hyperbaric oxygen? Besides Miss Susan. How do you guys have an idea how it works? What do you think? Well, most of the doctors I talk to say, well, it's obviously giving more oxygen to the tissue and this and that and everything. I said, well, yeah. Anybody here a diver? Right? You don't really want to use pure oxygen when you dive, right? So, I said, how does it work? Well, let's see how it works. Let's go to the next slide. Okay, so basically what hyperbaric oxygen does, among other things, it increases nitric oxide production in the body. And let's go to the next slide. According to the work of Dr. Tom at the University of Pennsylvania, this nitric oxide makes the bone marrow secrete lots and lots of stem cells. And that's how it really does all its miraculous things, among other things. I mean, there is some aspect with the oxygen. Remember the second slide I have, cells, not doctors, heal the patient. If I have a diabetic patient who has a wound on his foot, oxygen, you can give him all the oxygen in the world. The only thing that's going to heal that wound is stem cells. And that's how it works. So I said to myself, I said, well, you know, unfortunately, I'm not in the Caymans all the time, so I don't have Susan next door to me. So what can I do? Because I have patients, they'll fly in from this place, that place, and going to be there a day or two, and then they're flying out. So I can't send them for 20 treatments. So I said, what else could I do? So let's go to the next slide. So I looked and I said, nitric oxide. So now I'm going to give you guys a pearl. There is a supplement out there. It comes from the University of Texas, and that's how you can tell, by the way, a pedigree, if you have something from a university. It's called nitric oxide, or I should say Neo-40, okay? And what it does is it increases nitric oxide production in your body. It's a very pleasant tasting longevity. You suck on it for 10 minutes or so, and it helps good. The other interesting thing you have to realize about nitric oxide production, does anybody here use mouthwash? Don't use it anymore. Because what the mouthwash does is it kills the anaerobic bacteria on your tongue, which help convert nitric oxide to forms you can use. So you just go online, you can read about it. It's something you should not ever use. So anyway, I give my patient this supplement and it increases things. Now, what does it do? It lowers the blood pressure and things like that. It helps mentation. It does. You know, I could spend the next week talking about nitric oxide itself. It's one of the most important signaling molecules in the body. And the reason why they call it Neo-40 is once we reach age 40, we can't really process it as good as we used to. We could usually get a large need to make it, but no more. So these are some of the supplements that I like to recommend to people. So we have the omega-3 fatty acids, which are basically fish oil, but realize now, it's really coming from algae. It's not really from the fish itself. Now, when you look at fish oil, a couple things. Put it in the freezer, take it frozen. The only thing that counts is the EPA, DHA. Everything else is baloney, it doesn't matter. And those two things together should be to about 3,000, okay? Now, the other thing about fish oil, if you're on a blood thinner, be careful because typically things that are good for you will thin your blood a bit. So just keep that in mind. Next thing, anybody know about resveratrol?
Yes, red wine.
Red wine, what about it though?
I have no idea.
Okay, well, he's good, he's honest. Yes?
It slows down aging.
Exactly. And we're going to talk about that. So, you know, it's interesting. What this is, you know, resveratrol, they call it the French paradox. Is there anybody here from France or Quebec that I'm going to offend? Okay, good. So they say the French, okay. You know, I got to be careful because there's a lot of Quebec people in Florida when I give a talk once in a while. Usually I don't talk to the lay people. I have somebody else do it for me. But, all right, so basically they say it's the French paradox. The French, they don't like to exercise. They like to smoke, rich foods. Yet they have very little way of heart disease and they have some good anti-aging properties. They think it's from the resveratrol of the red wine, the grapes.
So what are the Italians?
Well, I'm Italian, of course. Right, so, but let's get to something even better. Now see that other word? Anybody can pronounce that one? Forstilbin, okay? Now that's a very interesting supplement that I suggest you all get on. Okay. This is from the work of Dr. Sinclair at Harvard. Okay. He's the one that told us about resveratrol. Okay. Now, what do these things do? They basically affect something called the sirtuin genes, which I'm going to talk about in just a few minutes. Okay. Let's go on. A phytonutrient. Okay. Well, a phytonutrient is basically what gives fruits their color, their flavor, their smell, etc. Vitamin D, I already talked about. That's not a vitamin; it's a hormone. Okay. Stem XL. That's another pearl I'm giving you. That comes from the University of South Florida. Dr. Bickford and Sandberg, two very prominent stem cell scientists, made it. Quercetin. We're really seeing how important that is now. I'm going to talk about that shortly, okay? Melatonin, I already mentioned that about osteoporosis. The other thing melatonin does is it protects you from radiation sickness, just in case, God forbid, there's ever any problem there. NAD, we're going to talk about shortly, but here's number 10 is an interesting one, fucoidan. Fucoidan is an algae found off the coast of Okinawa. Anybody know about the people of Okinawa? Longest lived in the world.
Yeah.
Their diet is extremely rich in this. And what does fucoidan do? Lisa, what were we doing with fucoidan a couple of years ago? We were giving it, right? For the V cells, to stimulate the stem cells. And the stuff we looked at, if you ever went to the zoo and you went to the fish pond and you put a quarter in there and you got this stuff out that, you know, you had to go like this, well, that's what it smelled like. It was awful, right, Lisa? Awful. But, so fucoidan's another thing I would say, as long as you get a good source of it, might not be a bad thing. I don't take it yet, but I'm gonna probably start doing it. Okay, next slide. So, you know, one of the things we talk about, inflammaging. Aging and inflammation are like this. The more inflammation you have, the quicker you age. The less inflammation, the slower you age. Let's go next slide. And it's not just me, Time Magazine, secret killer, surprising link between inflammation, heart attacks, cancer, Alzheimer's, and other diseases. Okay, so I don't know what year that was from, but it's not too long ago. Next slide, please. This just gives you a rough idea of all the things, and the real kicker is the low-grade inflammation. That's why they always say, you know what, you should make sure you don't have too many cavities and, you know, dental hygiene. I'm not a dentist, but it has some validity to it. But look at all the things when you have a low chronic inflammation, okay? Next slide, please. Okay, so basically, a lot of this inflammation has something to do with what we call a free radical. And that's because we use oxygen. Oxygen makes free radicals. Next slide, please, Peter. Okay, so we can see here, an antioxidant kind of loans an electron. We're getting back to our basic high school chemistry. But these are like ISIS terrorists. They want to go and attack us and rob us of energy and really make us not do well. And look at the things, poor diet, atmosphere, ultraviolet rays, etc. Next slide, please. And what do they affect? The mitochondria. Mitochondria are the powerhouses of the cell. So just think of, you know, how society would be if all of a sudden here in the Cayman Islands, all of a sudden the power plants closed down and the generators didn't work. Wouldn't be like we knew. So next slide, please. So again, we know the antioxidant loans a pair of an electron. Let's go to the next thing. Anybody ever hear of something called the oxygen radical absorption capacity? Well, I just mentioned it. It's the antioxidant. Same thing. But you know, I like to sound important, so yeah. Okay, so anybody have ideas what the best antioxidant out there is? Let's have some guesses. Vitamin C, good guess. Anything else? Probiotics, well then that's not quite the same. Probiotics are important. Well, how about some other things? Remember we kind of talked about, you know, curcumin, very good guess. Xanthium? You mean from algae? Yeah, that's a good one too, but now, because I got to give a clue then. All right, I'll give you this clue. Once I start giving the clue, the doctors never get this question either, okay? There's a certain holiday in February. You give this item to your sweetheart. Look at this. Look at green tea up on top. Pretty healthy thing, right? Apples, broccoli. You say, oh, broccoli's really good for you, okay? Strawberries, blackberries, dark chocolate. Now, emphasize the word dark chocolate. You know, I usually am not a fluster for words, but I had one lady once that said, well, you know, you said 5 different colors a day. How about if I have 5 different color M&Ms? I said, not what we're thinking of, okay? Here's the problem. You know, a lot of the chocolate out there is loaded with sugar, which is one of the worst things you could ever take. So what I do is, I'm gonna tell you my little trick. I get my chocolate from a place called Santa Barbara Chocolate Company. I go online, I get 22 pounds at a time, it's in pellets. What we do is we melt it down in a microwave. We mix a tiny little bit of rum in there. We put stevia, which is a great sweetener as far as I'm concerned, and some walnuts. And I've made one of the best health foods I could eat, and I have a piece every night. We make little balls out of it. It's great, and it really, you can see. Let's go to the next slide. I can show you some of the other things about chocolate. Chocolate has something called PQQ. It's a very important antioxidant, and we think it has something to do with your mitochondria. Let's see how much PQQ is in chocolate compared to some other things. Okay, let's throw some of the benefits. Anti-inflammatory, nerve protection, you know, basically maybe prevention from Alzheimer's, who knows? Collagen production, you know, so it keeps maybe some of the wrinkles away. Next slide. Look at the amount of chocolate, cocoa powder, 800. Next thing close to it, fermented soybeans, 61. So to not eat chocolate, you know, it's a good thing, I'm telling you. But don't get the sugar. You gotta, no sugar in it, okay? All right, next slide, please. All right, let's talk a little bit about cytokines, okay? Cytokines are the growth factors. Again, that's my cell phone. Next slide, Peter. You know, basically all diseases are a result of a cytokine imbalance. You have heart disease, cancer, kidney disease, your cytokines are out of whack. And some of the medicines ultimately are stimulating these pathways. And it's dependent on our immune system also. That's why somebody mentioned probiotics. Very important to take those every day. So we want to basically enhance our immune system. A lot of medicines basically go down to stimulating certain bacteria in your gut, okay? Okay, and this kind of sums it all up. If you have too many cytokines, you have a hyperconcentration, you have disease. Too little, you have disease. You have to kind of be in the middle somewhere. We use these on all our patients. We have cytokines that we give orally. Now, we don't give it if someone has a history of a cancer. I just don't do it for medical legal reasons, but otherwise we give it to everyone. Now, these are some of the things in our patches. Now, this is something you can only find here in the Cayman Islands, Boca, the Cayman Islands, and the Dominican Republic. These are our own thing. We actually have these registered with the FDA. We're going to be selling them probably in June sometime. We put these little patches on. I have some of my patients here, so they're familiar with it. Little patch that goes on the joint or whatever. Sometimes we put them on the carotid arteries and things like that. This kind of ties it all together. Your immune system, PRP, injuries, and things like that. Real quick, we basically have some cutting edge things. We have our own type of bone marrow procedure that is just light years ahead of everyone else as far as I'm concerned. And you know, I have a network of doctors that I teach and I give them kits and things like that. Next slide, please. Okay, so can science lead to the fountain of youth? All right, so basically, we want to target the causes of aging. All right, so here's the real key though. Most places that are doing, quote, anti-aging are addressing the downstream effects of aging. You know, and say, okay, you know what, I'm going to put you on testosterone, or you're going to be on estrogen, you're going to do bioidentical hormones. Well, that's all well and good, but all you're doing is you're treating the downstream effects of aging. You're not going upstream to really get the problem at hand and fix that, because if you fix that, you won't have a problem with your hormones and things like that. So that's what we're really trying to address. We call it the Advanced Cellular Repair Division. All these things here, the failure of these things is going to ultimately lead to your demise, to disease, problems, et cetera, et cetera. And it's just these couple of pathways. And we know there's ways that we can stimulate them, and that's what we're going to talk a little bit about. Next slide, please. Now, Time Magazine 2018 is an anti-aging pill on the horizon. You betcha, it is. It's here, okay? And we're doing it now. It's something called NAD, nicotinamide adenine dinucleotide, okay? I'll get into that in a little bit. Let's go to the next slide, okay? I want to go back to the slide that we saw. This is not a mistake that I put this slide in by accident again. And I want to look at these guys right here. They're sirtuin genes. Remember we mentioned a little bit about resveratrol, anti-aging. That's what resveratrol is stimulating, this set of genes. And look what it really does. Mitochondria. Also, it goes to reactive oxygen species, free radicals, okay? Those are the two big things in aging. Now, the mitochondria is the biggest thing of all. When you start failing, when you start getting degenerative disease, it's because your mitochondria, which makes power for the cells, start diminishing in function and diminishing in number. That's a sirtuin-1 gene. Look at all the effects it has, okay? Sarcopenia, you've heard of osteopenia in the bones? Well, sarcopenia is the muscles, same thing, wasting of the muscles. Diabetes, liver problems, diabetes again, inflammatory bowel, lung, cancer, Parkinson's, Alzheimer's, et cetera, et cetera. All because of this gene and its malfunction or not being stimulated properly. Next slide, please. So what do we know that can stimulate this? Well, the NAD is probably by far the most important. Torstillbene and resveratrol. And this is not my, epiphany. This is the work of Dr. David Sinclair at Harvard Anti-Aging Facility. I mean, he runs a whole division there. High intensity training gets your heart rate up to about 140, 150, depending, you got to get checked by your physician and make sure you're okay. One of the most important things you can do, intermittent fasting and calorie restriction. Low carb diet, basically keto diet. And also, interestingly enough, a sauna, and extreme cold. They also stimulate these pathways. This is one of the most important pathways you could ever do. Probably the most important slide of the night, right here, to keep yourself young. Simple as that. Just do these things. You got a good chance of staying young and functioning pretty good for many years. NAD, nicotinamide adenine dinucleotide, goes back to like the Krebs cycle and everything. What does it do? It makes mitochondria be more efficient, makes more of them, it makes ATP. Look at all the things it has an effect on. Cancer, degenerative disease, cardiovascular, bone, you name it, aging. That's it. This is what this magazine was talking about, Time magazine. Next slide, please. There we are again. Deficit telomeres, brain health, my immune system, DNA repair, okay? We have enzymes in our body that try and fix our DNA because as we age, we get more and more damage to the DNA. But these enzymes are big hogs of the NAD and they really consume a lot of it. And when there's not enough to go around, they stop doing their work. And all of a sudden, you get damaged DNA. What does that do? It leads to a bad cell, which can lead to a cancer cell. So, am I saying it's going to prevent cancer? No, but you know what? I don't want to take a chance. I'd rather try and go that way. Let's go to the next slide, please. So, look at how levels decline as we age, okay? Significant, okay? And you know, the more that declines, the less healthy you are. Next slide. What we have that sets us apart, so you can find clinics that'll do NAD, but we have the missing link here. We have something called an NAD kinase patch. We put it on the patient. This enzyme goes into the body and it's good for a couple of weeks. And what it does, it allows the body to utilize the NAD. Because even if I give it to you intravenously, you can only utilize so much of it. When I give you this patch, you'll utilize a heck of a lot more. It's so much more efficient. And we've got the technology for that. And that's what it looks like, just like the other patches, except this has the kinase patch in it. Next slide. So here's the NAD chamber of horrors. Low NAD, okay. Inadequate sirtuin, the sirtuins are important. PARP, that's the enzyme that fixes your DNA when it has a lot of damage. Inadequate DNA repair. So basically the bottom line is you're gonna go on to cancer lines. Mitochondrial dysfunction and death. Next slide. Okay, next slide. Excessive mitochondrial aging. Okay, so next slide, people. Okay, so here we are here. 3 outcomes of NAD levels. Low levels, you're gonna have disease. Really low levels, you're gonna die. Longevity is when you have good high levels, okay? One of the most important things you can do, and yet, you know how many times, there's a lot of doctors, they tell us, NAD, yeah, that's something that they don't even know about. This is so important, this is so cutting edge of the cutting edge. Again, we're tackling aging up here, upstream. We're not going down here. That's not gonna help us too much. We're just trying to put the fire out here. Over here, we're not gonna even let the fire begin. Okay, next slide. So, low NAD means decreased DNA repair. We can go to the next slide because I already kind of mentioned this, okay? Now, calorie restriction. It has a very profound effect on many different anti-aging pathways. There's sirtuins, something called the foxheads, AMPK, another very important pathway I'll mention in a little bit. It helps with all sorts of things. Tumor suppressor genes, okay? P53, very important thing we'll talk about shortly. Okay, next slide, please. Again, calorie restriction. These are all the different pathways of aging that has a very beneficial effect on, okay? I mean, all these things can be made better by calorie restriction. Next slide. Okay, keto diet is similar to calorie restriction. I mean, look, we all cheat a little bit. I cheat, I'll have a little carbohydrate here and there, but I definitely try and stay away from any sugar, but I try and stay away from the carbs mainly. Okay, next slide, please. Okay, senescent cell. Another huge thing that even most docs don't know about. These are cells that should have died but did not die. They live in our body, and because they didn't die, they start secreting all these bad growth factors which cause all kinds of big problems, okay? Now, there are things called senolytic agents, okay? One of them is quercetin. There's another one. It's basically, next slide. I think I may show it on that slide, actually. Well, these, again, I already kind of mentioned what they do. Next slide, please. Okay, right here, I'm going to be getting some of this medicine. We're going to have it at the clinic. Dasatinib. That's basically a leukemia medicine, but it has this effect of killing these cells. Very, very profound effect. I mean, Johns Hopkins is doing some good research on this for osteoarthritis, among other things, okay? So you can see it there. Next slide. But we have a great way of attacking these cells already. We have something called the P53. This is another patch that we use, okay? P53 is also called a tumor suppressor gene, okay? What it does is it looks at a cell and analyzes it, says, you got too much DNA damage, I'm disabling your mitochondria, you're gonna die, and I'm gonna just kind of use some of your parts. Or, you have some damage, but I think I can fix you up and make you better. So that's what it does. Now the problem is, as we age, this gene starts to not work so well. And sometimes it has a mutation, and that's when cancers are allowed to grow. Now, I have a blog, you can go read about it. I said, what does longevity, the P53, and elephants have to do with each other? An elephant is the largest animal on earth, essentially. Maybe a whale's bigger, I don't know. But elephant almost never, ever gets a cancer because it has multiple copies of the P53 gene. So we have it now. We do it as a series of patches once a week for 3 weeks. And it can really, we think, help with these cells and may help prevent some cancers. Again, I don't like to get that slippery slope there. Well, I'm gonna help you prevent cancer, but there's science that's there. Okay, next slide, please. And that's the patch right there. Next slide, please. AMPK, another very important thing. Anybody here take metformin for diabetes? Anybody know about metformin? You hear about it? Okay. Metformin is a pill, it's very common, you take it for diabetes. AMPK is stimulated by these certain supplements, and this is a switch that can regulate cell function of glucose, burning of fats, and formation of new mitochondria. Next slide. Okay, there's all the bad things that happen when you have a deficit of the AMPK. Okay, and here's the stuff right here. I take this faithfully. Barberine, over the counter. It helps stimulate this pathway. Next slide, please. Here's some of the things to take. Terstilbin, NAD again, barberine, metformin. Metformin works by stimulating certain bacteria in your gut, okay? The keto diet, calorie restriction, intermittent fasting, high intensity interval training, okay? So a lot of the same things seem to affect multiple pathways in a good way. Next slide. Okay, the last one we're going to talk about is mTOR pathway. It's another very important thing that most people don't even know about. It's crazy that they don't. Okay, let's see the next slide. Okay, basically this coordinates, again, how the cell processes its energy, how the cell takes in glucose and burns fat and things like that. Has a profound effect on longevity, okay? And this is what the mTOR does. It helps with making protein and things like that, and all the good things it does, metabolism, new blood vessels, digestion of cellular debris, etc. Next slide. Okay, and interestingly enough, there's something called rapamycin. Now, this is something that was found in the soil of Easter Island. It has profound effects on this pathway. Now, it also is used for people who have a organ transplant because it helps lower their immunity, but in very low doses. And we'll have that available probably within the next 2 months. We'll have the whole program for this, and we just have to do it, you just do it a little bit. You don't keep doing it over and over and over. And finally, we have a CoQ10 patch that we're talking about. I think we're almost there. Next slide, Peter. Okay, so basically, stem cells, we need to keep them going. And everything we're gonna do in the anti-aging pathways, eventually it has to work with the stem cells, okay? So how we can regenerate them, AMPK, the NAD levels, the sirtuins, the mTORs, and things like that. These are all from 2017, Hematology Oncology Stem Cell Therapy, not somebody's garage journal or something like that. And with that, see up north where I grew up, that was a stem cell for a snowman. Well, thank you all so much. It's been my privilege and honor.